Do you find these benefits independent of weight loss? If you find these benefits independent of weight loss, does that, like, do you see the patient staying on those drugs? You know, you have a maybe a patient who's overweight, psoriasis, you have them on a biologic, their skin's much better. You have them on this weight loss medication and they're not losing weight. Do you keep them on it because you're like, well, it would show these other benefits, and I know you're not losing weight, but we showed this improvement in cardiovascular. Like, I can't see that happening. I can't see the patients continuing to take the drug if they're not seeing the benefits of like the weight loss, which or type 2 diabetes.
Yeah, I think it's hard to get patients to stay on a medication for an unknown thing, like maybe this will reduce your risk of having a heart attack or a stroke, right? If they have something tangible, like your blood sugars are down, you're not on as much insulin, you're losing weight, your disease is getting better, then that probably, I think that if it makes a disease that they can quantify better, they'll probably stay on it. I think if it's like, you would have a 35% reduction in your stroke rate. That's going to be a tough sell.
Yeah.
For patients to stand. You know, the other thing that's interesting, Matt, because you talked about being on compounded Tirzepatide is, I always wonder, like, you know, these things are so prevalent out there. And so none of these are going to be captured in TriNetX, right?
Oh.
They're only looking at pharmacy prescriptions and
Ooh.
pills. They're not going to capture the people who are on compounded medication. So I don't know the answer to what percentage of people on GLP-1s are on the real deal or those that are kind of getting it off the internet compounded.
For example, something that I think a lot of doctors or providers in general don't know is there is a warning. It's no warning, but like a recommendation, right, on tirzepatide. Because it leads to delayed gastric emptying, a woman of childbearing age, you're supposed to tell them not to be on an oral contraceptive, because that can lead, it's on the product insert. Because
Why?
you know,
Because
I think it delays gastric emptying of the pill.
so they
So you
don't.
don't get you don't
So
get
it's not as
regular
effective.
absorption.
Correct. And so they tell you in the product insert they need to be on some form of systemic birth control, like an IUD or a patch or whatnot. Because you know how they attributed in the beginning the baby boom of Ozempic?